In today's video, we'll uncover 5 common medications that might just be putting your vision at risk. The eyes are delicate and a powerful part of the body that often doesn't get the attention it deserves. We rely on our eyesight for almost every task, big or small, yet most folks don't think about how something as simple as a pill can impact it. With so many of us over 50 taking medications regularly, whether it's for blood pressure, allergies, or joint pain, the potential for medication side effects on eye health is higher than ever. Medications we might think of as harmless can quietly lead to dry eyes, blurred vision, or even more serious issues, like changes in color vision. It's easy to brush off a bit of dryness or mild blurriness, but did you know these can be warning signs of deeper, longer-lasting vision damage? For example, if you're noticing light sensitivity or have started needing more eye drops throughout the day, it could be your body signaling that a medication is impacting your eyes. And while it may seem like just a minor inconvenience, keeping tabs on these symptoms can help you spot any serious problems before they worsen. Stick around, because by the end of this video, you'll know exactly which meds to be cautious about and the steps you can take to protect your vision. Now, if you're already wondering which medications to look out for, let's start with a very common one that has surprised many. A medication so widely used that it might be sitting on your shelf right now. Medication number 1, corticosteroids. Corticosteroids, a name that rings a bell for many, especially those dealing with conditions like arthritis, asthma, or allergies. These are powerhouse medications, often prescribed to tackle inflammation and relieve pain, but they don't come without their share of potential side effects. You see, corticosteroids work by reducing inflammation in the body, which can be a game changer for conditions like rheumatoid arthritis or severe allergies. But here's the kicker. Corticosteroids can also raise your risk for developing eye health issues, specifically cataracts and glaucoma. Imagine Mary, a 65-year-old who started taking corticosteroids for her arthritis. After a few months, she noticed her vision wasn't as sharp, and bright lights began to bother her more than usual. A quick visit to her eye specialist revealed early signs of cataracts, a common side effect of corticosteroid use. Eye specialists usually advise people like Mary to get regular eye exams, especially if they're on corticosteroids long-term. These exams aren't just routine checkups. They can catch issues early, giving people the chance to adjust their treatment before more serious damage occurs. And speaking of adjustments, it's always a good idea to talk to your doctor about your dosage and frequency, ensuring you're getting the benefits without putting your eyesight at unnecessary risk. So if corticosteroids have become part of your daily routine, don't skip out on those eye exams. They're a small step that can make a world of difference. But corticosteroids aren't the only common meds with side effects like these. Let's move on to another, often used by those with pesky seasonal allergies. Medication number 2, antihistamines. Antihistamines, our go-to allies for allergy season. Whether it's springtime pollen or a sudden dust reaction, these meds help us get through the day without sneezing up a storm. But here's something not everyone considers. While antihistamines work wonders to keep allergy symptoms at bay, they can also lead to a few unwanted side effects on our vision. Ever notice that after taking an antihistamine, your eyes feel a bit drier than usual or that your vision seems slightly blurred? That's because antihistamines reduce tear production, which may not seem like a big deal but can be quite bothersome, especially for those over 50 who may already struggle with drier eyes. Imagine Jack, an active 60-something who loved his morning walks but found himself constantly reaching for eye drops after taking his allergy meds. To help with this, it's smart to make a few tweaks to your routine. Consider running a humidifier in your home to keep the air moist, drink plenty of water to stay hydrated, and maybe use artificial tears as a quick fix for those drier days. There are even natural alternatives, like quercetin, a compound found in foods like onions and apples, that some folks use as a gentler way to manage mild allergy symptoms. But if you rely on antihistamines regularly, keep a close eye on how they affect your vision, and don't hesitate to mention any changes to your doctor. Now, antihistamines are just the tip of the iceberg. Up next is a class of medication that helps with mood, but might surprise you with its impact on eye health. Medication number 3, antidepressants. Antidepressants. These medications have been lifesavers for many, helping to manage conditions like depression and anxiety. But here's something you may not have expected. While they bring balance to mental health, they can quietly disrupt your eye health. Antidepressants, especially those known as SSRIs, selective serotonin reuptake inhibitors, can impact tear production, leading to what's commonly called dry eye syndrome. Dry, uncomfortable eyes might sound minor, but if left unchecked, this dryness can lead to blurred vision, light sensitivity, and even an increased risk of infection since tears play a big role in protecting the eyes. Think of Bob, who found that after a few months on antidepressants, his eyes started feeling scratchy and his vision a little hazy. After a quick checkup, his doctor recommended adding a fish oil supplement rich in omega-3s, which helps improve eye lubrication naturally, along with taking more frequent breaks when using screens. Small adjustments like these can make a noticeable difference in eye comfort and are often worth a try if you're in Bob's shoes. And of course, stay connected with your healthcare provider, as there are several options to fine-tune the treatment if symptoms become bothersome. Antidepressants are powerful, but with a little awareness and proactive care, their side effects don't have to cloud your sight. Now, let's look at another type of medication that's all about keeping the heart steady but could have an unexpected impact on your eyes. Medication number 4, beta blockers. Beta blockers. If you're over 50 and managing blood pressure or heart health, there's a good chance you've heard of these or may even take them. Known for their effectiveness in reducing high blood pressure, beta blockers work wonders for the cardiovascular system by slowing down the heart rate and easing blood vessel tension. However, here's a lesser-known fact: they can also reduce tear production, leading to dry eyes, which, if persistent, can make reading, watching TV, or using a computer screen uncomfortable over time. Picture this: Sue, a 62-year-old beta blocker user, noticed her eyes felt dry and gritty after her evening TV time, and those drugstore eye drops only helped so much. Her doctor suggested a more regular application of lubricating eye drops and even recommended the occasional use of a warm eye compress to stimulate natural tear production. Small, consistent steps like these can help keep the eyes comfortable, especially for those who rely on beta blockers long-term. Additionally, if dryness persists, it's worth discussing alternatives with your healthcare provider, as there may be options that are easier on the eyes. But Sue isn't alone in this. Dry eyes can affect anyone on beta blockers, which is why keeping up with these simple habits can be so beneficial. Now, let's talk about a medication that's very popular and often associated with other health benefits, but has its own unique set of risks for eye health. Medication number 5, PDE5 inhibitors, Viagra and similar. PDE5 inhibitors. Names like Viagra or Cialis might ring a bell here. These meds are commonly prescribed to treat erectile dysfunction, ED, a condition that often appears with age and can impact both physical and emotional well-being. While these drugs can help restore confidence and improve quality of life, there's a hidden risk for eye health that many don't realize. These medications work by increasing blood flow, which is great for some areas of the body but can spell trouble for the eyes. In rare cases, PDE5 inhibitors have been linked to changes in color vision, heightened light sensitivity, and more rarely, sudden vision loss due to optic nerve issues. Imagine Tom, a 68-year-old who noticed a subtle bluish tint to his vision after starting Viagra. His eye specialist quickly reassured him that these symptoms often fade within a few hours, but they advised him to report any sudden dramatic changes right away. Being proactive is key. If you're using a PDE5 inhibitor, take note of how your eyes respond and be quick to check in with a healthcare provider if something feels off. Regular eye checkups are crucial, as these can reveal early signs of any potential issues. Keeping an open line of communication with your doctor can help catch these side effects before they lead to more serious complications. Now, with these 5 medications covered, let's move on to some general tips that everyone can use to keep their eyes healthy, whether they're on medication or not. General eye protection tips. When it comes to protecting your eyesight, especially if medications are part of your daily routine, there are several proactive steps you can take to maintain clear, healthy vision. First, it's essential to fuel your body with eye-friendly nutrients like omega-3 fatty acids, vitamins A, C, and E, which are often found in foods like fish, leafy greens, carrots, and bell peppers. Even something as simple as incorporating more of these foods into your diet can give your eyes a natural boost. Regular eye checkups should be a non-negotiable part of your health routine, especially if you're over 50 and on medications known to impact eye health. Catching issues early allows for timely adjustments, which can help keep minor irritations from becoming major complications. And don't forget to stay hydrated. Many medications can lead to dry eyes, so drinking enough water throughout the day is a simple yet effective way to combat this. Adding a humidifier to your home environment can also help maintain moisture in the air, reducing eye dryness. Finally, maintaining open communication with your healthcare providers about your medications and any new symptoms can make all the difference. Don't be afraid to mention even minor changes in your vision. They're here to help. Now, with a solid understanding of how to protect your vision, let's quickly recap the 5 medications we've discussed and how they might impact your eyes. To wrap up, Let's briefly go over the 5 common medications that could have surprising effects on eye health. First up, corticosteroids, a powerful treatment for inflammation but one that can raise the risk of cataracts and glaucoma with long-term use. Next, antihistamines, the trusted allergy relief, can reduce tear production and cause dry eyes, especially in older adults. Antidepressants, while life-changing for mental health, can bring on dry eye syndrome as a side effect, affecting daily comfort and eye protection. Then we have beta blockers, widely used for blood pressure control but also known to reduce natural tear production, leading to uncomfortable dryness. Lastly, PDE5 inhibitors, such as Viagra, are helpful for ED but come with potential risks for light sensitivity and, in rare cases, vision changes. Each of these medications has a unique benefit, but they also carry risks that are worth monitoring to protect eyesight. Being aware and taking proactive steps, like regular eye checkups, a nutrient-rich diet, and open communication with your healthcare provider, can make all the difference. So, let's look at how you can bring this knowledge into your life for better eye health. Alright, so now you know the 5 popular medications that could be quietly impacting your eyesight. But what will you do with this knowledge? Are you ready to take proactive steps to protect your vision and keep it as sharp as ever? Remember, these small changes, like regular eye checkups, staying hydrated, and keeping open communication with your doctor, can make a significant difference. If this information has helped, don't forget to like this video, share it with others who might benefit, and subscribe to the channel so you never miss out on more health insights. And before you go, be sure to check out the next video on your screen. It's packed with more tips on staying healthy and informed as we age. Here's to clear, healthy vision for years to come.